I'm Dr. Pack from Dover Dental Clinic. I'm here to answer any questions regarding restorative dentistry, which is the majority of what we do at Dover Dental Clinic. So what procedures would fall under restorative dentistry? That is a great question. It is a big range from something as simple as a filling to something a little bit more involved like implants, dentures, anything that replaces your tooth back to health. Cosmetic and restorative dentistry are different in a few ways. Cosmetic it can address the health of the tooth, but it also enhances the appearance. So if you are looking for a brighter smile, a certain shade of teeth, a certain size, it enhances the smile overall. Restorative dentistry can assist in that, but it's mainly centered towards functional health. So that means, how do we make the tooth feel and function better? How does a dentist determine if restorative dentistry is needed? What I will do typically in my office is we start with a very thorough exam. We have a separate appointment where we are simply gathering a lot of data, mainly through x-rays, to make sure that we can see things that our naked eye cannot and diagnose things correctly. What would disqualify a patient from being eligible for a restorative procedure? That's often very rare. Most patients who are healthy and in generally good health qualify to have restorative dentistry done. If anything, that would help them improve their health. The few exceptional cases are patients who are on certain medications or have impending surgery or are just recovering post-surgery from a major event. Those would be our exceptions. Oftentimes, again, we would still invite the patient in for an exam so that we can do a thorough review and make a good decision on that. What materials do we use in restorative dentistry? So if we are doing a filling, for example, which is a type of restorative dentistry, we use something called composite. It is a tooth-colored filling. And it's wonderful because it can be placed in the front of the tooth, on your front teeth, as well as in your back teeth as well. Another example of a restorative material would be ceramics. We are very fond of ceramics. We have found that one of the most bio-friendly materials that our body adapts very well to. So all of our crowns that we do here at Dover Dental are made strictly of ceramic material. The benefits of restorative dentistry overall is health, right? Our teeth are part of our body. So when we have an issue where the body cannot repair itself, we are restoring it back to health. And what that in effect will lead to is better chewing that improves your nutrition, what you're able to digest and how you digest your food, as well as your mental health. Many people notice the smile as one of the first things that they can show the world. So if you can smile confidently, that will also improve your mental health. So without getting into too much of the weeds of restorative dentistry, the most common procedures would be fillings. These are very minor procedures, and typically the shorter the procedure is, the recovery time is a lot faster. So a filling may take anywhere from 30 minutes, at most an hour. You might be a little bit sore for a day or so just from the injection, but it's not painful. Something more involved, let's say like extractions, and then we restore you with a full denture, that may take a little bit longer to heal from. However, we can assist you during the whole healing process. And as each patient is different and each procedure is different, we make sure to take time to thoroughly explain the before and after of how to manage your pain best. Are restorative dentistry procedures painful? That is one of the most common concerns that most patients have. I can confidently say that dentistry is not meant to be painful. I think a more appropriate word for it is it a little bit uncomfortable? Yes, but so is any other medical procedure you may receive to get you back to health. So it is normal, and it is your body's way of recovering after any kind of procedure. That being said, overall, I would say that there is very little to no pain for most procedures, especially if it's managed well in a clinical way. Hope I was able to answer most of the most common questions in restorative dentistry. If you have any further questions or would like to set up an appointment to find out more, please call our office. It's 931-232-8287.